Introduction. Hazardous waste, if poorly managed, pose risk to human health and the environment. The Resource Conservation and Recovery Act (RCRA) provide a framework for appropriate hazardous waste management. Hazardous waste can come from various sources and take different forms. Medical waste is a subcategory of waste generated in healthcare facilities and is defined as potentially infectious waste contaminated by blood or bodily fluids. State environmental and health departments are responsible for regulating medical waste, and other federal agencies such as the FDA and OSHA may also have regulations. Medical waste is characterized into clinical waste, including bodily fluids and pathological waste, laboratory waste including chemicals and sharps, non-chemical waste such as plastic and paper, and kitchen waste posing indirect risk. Proper disposal of medical waste requires coordination with state environmental program and compliance with relevant regulations. History of medical waste. In response to concern about medical waste washing out on East Coast Beach in the 1980s, the Medical Waste Tracking Act (MWTA) of 1988 was passed by Congress. The MWTA was a two-year federal initiative that mandated the EPA to issue rules for the treatment of medical waste. The regulations went into effect in several states and Puerto Rico. However, the MWTA expired in 1991. Based on the data gathered during this time, the EPA concluded that the highest potential for spreading illnesses from medical waste occur at the point of generation and diminishes afterward. The risk of illness from exposure to medical waste for the general population is likely lower than the risk to healthcare workers.
Assalamualaikum, my name is Nurina Bihamiti Anwar and I would like to elaborate more about this topic started with characteristics of medical waste. During the COVID-19 pandemic, a new features emerged in the composition of solid medical waste, most notably in refuse of COVID-19 patients who have their food scraps and infected items categorized as infectious waste. The result increased the quantity of unwanted medical waste. There are three characteristics of medical waste, which are quantity, composition, and bulk density. Quantity of waste generated in hospital based on various parameters such as kilogram per bed day, kilogram per patient day, and kilogram per worker day. Next, determine the composition of waste materials. Having a comprehensive knowledge of the waste streams, especially the non-infectious portion, is advantageous in creating practical waste reduction and also recycling initiative. Bulk density is mass per unit volume, such as kilogram per meter cubic. In waste management, it is essential to know the aggregate density of refuse or waste components for various reasons, which include the storage space allocation, collection vehicle size, and estimating processing equipment needs such as compaction, size reduction, and disinfection. On the next point is measure classification of medical waste and management guidance in Malaysia. It has been classified into 5 classes, which are blood and body fluid, sharp waste and infectious waste, pharmaceutical and cytotoxic pharmaceutical waste, and other types of medical waste. Blood and body fluids such as blood-contaminated surgical dressings like cotton wool and swabs, plasters and wipes clean up body fluids and blood spills. Urine and stools from infectious disease cases are not recyclable linen. Pathology waste contain organs, placenta, and laboratory tissues. For the management guidance, it has infection control required specific treatment and ensuring all waste is fully incinerated in a suitable incinerator. Sharp waste includes needles, scalpels, blades, saw, and other tools that could cut or pierce. It's used in hospitals and healthcare facilities. Sharp waste must be collected with leak-proof container and resistant to punctures container. Then waste is separated, treated, and wholly disposed to avoid harm during incineration. For infectious waste risks such as lab risks from pathology, hematology and blood transfusion, microbiology, histology, and debris from post-mortem rooms. It relates with infection prevention related management specification such as autoclaving before disposal are imposed. Infectious refuse must be truly burned in a suitable incinerator. Furthermore, the classification of medical waste can be pharmaceutical and cytotoxic pharmaceutical waste and other types of medical waste. Unusable pharmaceutical waste such as expiry date exceeded following container opening, callback campaign prevents the use, and pharmaceutical with cytotoxic effects such as mutagenic, carcinogenic, and teratogenic used to treat cancer produce waste. Pharmaceutical waste was managed based on three classes. For example, Class 1 for cough syrup poses no risk during collection, interim storage, and trash disposal with municipal waste. Class 2 includes pharmaceutical with potential to cause harm if misused or taken without authorization. Utilizing a waste disposal facility allows for proper refuse management, while Class 3 for heavy metal containing pharmaceutical must be disposed at the approved waste disposal facility. In cytotoxic waste, intermediate storage of cytotoxic waste is controlled and secured. To protect workers, cytotoxic pharmaceutical waste must be segregated and incinerated. Lastly, other infectious wastes, which are healthcare waste, can potentially transmit infectious agents to humans or animals, includes bed pain liners, urine containers, and disposal ostomy bags. These items are identified or evaluated by physician and surgeon. It is incinerated in a facility with the Department of Environment license to dispose of hazardous waste. Medical waste classification according to Environmental Quality Schedule Waste Regulation 2005, it has been classified with Schedule Waste Code and type of medical waste, such as SW403 for drugs containing psychotropic substance or toxic, detrimental, carcinogenic, mutagenic, or teratogenic drugs has been discarded. SW404, the disposal of infectious waste, clinical waste, and isolated materials. SW421 for a mixture of scheduled waste, while SW422 is a mixture of scheduled and non-scheduled waste. Management and disposal medical waste is within Environmental Quality Schedule Waste 2005. It involves segregation, labeling, marking, collection, central storage location, internal transportation, documentation to minimize potential hazard to public health and environment. Color coding separated healthcare waste by nurse or clinical personnel, such as black bags for general waste, yellow for cremated medical waste, and light blue for autoclave waste. After autoclaving, the blue label medical waste will transfer to a yellow bag or container before being incinerated or otherwise disposed of. Only sharp waste goes into the sharp containers. After depositing the waste into bags, containers are marked with a hazard symbol and the start date of planned waste and the waste producers. A skilled porter transports segregated medical waste to the central medical waste storage using specialized wheel bin or carts. After delivering medical waste to central location or storage, the trolley and the container must be disinfected. The central storage climate control may hold rubbish for 48 hours before porters transfer it to the incineration facility. Utilization of incineration as treatment approach for managing infectious and hazardous waste is prevalent in Malaysia because of it reduces the overall volume of waste, eradicating pathogenic and anatomical waste and potential for energy recuperation. Alternative clinical waste treatment technology is needed to minimize landfill hazard and future space limits because landfill have leachates or gas that can damage soil, groundwater system, and elevate the atmosphere temperature, harm the human health if not controlled properly. Incineration fly ash must be buried, and infectious medical waste burn kills the bacteria and microbes and minimize the environmental effect. That's all from me. Thank you.
Next, let's move to the sources of medical waste. The major contributing source of medical waste is from the hospital or health facilities, laboratories, research center, mortuaries, autopsy center, animal research, testing laboratories, blood banks, collection service, and nursing home for the elderly. The infection waste and pathological waste. The infection waste is the tool that used for medical purposes that are contaminated with body fluids such as blood and discarded diagnostic sample, cultures, and stock of infection agent from the laboratory work and waste from the patient with infections. This contamination may contain bacteria, viruses from the fluid which can be harmful to human body. This waste is commonly from patients that are infected by the disease such as HIV, Ebola, and surgery. The pathological waste is contributed from the organ, tissue, or part of the body that have been removed during the surgery. The second one is sharp waste. Sharp waste is a biomedical composed of used sharp tools that are contaminated by infectious waste and involve syringe, needles, lancet, broken glass, and the other material that can pierce into the skin. Besides, using sharp instruments in hospital, people also use them at home for the medical purposes for chronic disease such as diabetes. The sharp waste combined with the pathogen from the patient can be dangerous and could break it through the skin. The infection can be spread to the body. Sharp waste is categorized as the most dangerous waste. The third one is the pharmaceutical waste. The pharmaceutical waste commonly contain medicinal drug or OTC drug. This medicinal drug or OTC drug become a waste because they are expired, unused, discontinued, damaged, or contaminated. This medicinal drug need proper management. Pharmaceutical waste can harm people's health or the environment. India generates almost 10 until 15 million of tons biomedical and pharmaceutical waste and 4% of average annual growth rates based on the Bhattacharya 2021. Next is radioactive waste. In the medical field, radioactive waste produced from the radiation therapy or nuclear medicine department. The radioactive waste exists in many types of forms, such as the equipment in hospital that has been contaminated by the isotope, clothing that patients wear on the personal protective equipment PPE that has been contaminated by the isotope from the radioactive. The pathological waste is also one of the sources that contribute to the radioactive waste produced from the biological waste. And the cytotoxin waste. Cytotoxin waste is produced from the contaminated material of the cytotoxin drugs in cancer chemotherapy preparation in the medical field. Cytotoxin can highly inhibit living cells. And the last one is chemical waste. Chemical waste can be divided into two, which is hazardous waste and non-hazardous waste. The chemical waste includes the reagent and solvent that are always used in the laboratory of medical work. For the example are X-ray fixtures, cleaning and sterilizing agents, and batteries.
My name is Asnatullah Shikin binti Abdul Rahim from Group AS2296A and my ID number is 2020828144. So I am going to continue the presentation to explain about the assessment of clinical scenario in Malaysia. Over the last few years, clinical waste creation from healthcare institutions in Malaysia has grown quickly. The COVID-19 pandemic has most recently caused the clinical waste generation to double. Clinical waste only make up a small portion of total amount of waste produced compared to the other type of waste. However, this tiny portion of solid waste stream is potentially infectious and hazardous, which could have serious negative effect on both human health and environment if handled and disposed of improperly. Despite the development of HIV, Malaysia implemented a clinical waste management system in 1980, stated by Choi Yee and Nur Hazwan Yusof, 2021. The assessment clinical scenario is pandemic-induced waste generation. The World Health Organization (WHO) designated the coronavirus disease outbreak COVID-19 a public health emergency of worldwide concern on 30 January 2020 and a global pandemic on 1st March 2020. Malaysia was dealing with a potentially fatal COVID-19 problem from the middle of March to the end of April 2020, and the situation has gotten worse. Unknown to the global at the time, COVID-19 was a pandemic that spread quickly to become a pandemic, stated by Mat Hamzah 2021. Next, the figures show that on 27 July 2022, Malaysia has 8,904 COVID-19 cases and caused 124 deaths, stated by Agamutu and Barasarati 2021. Each day, hundreds of new COVID-19 cases are reported worldwide. It was anticipated that clinical waste creation would rise as a result of large number of illness, both internationally and domestically. Based on the table, it describes that Malaysia has reported an increase in clinical waste production of 27%, primarily due to COVID-19 related waste. The medical staff increasing use of disposal gloves, face masks, and personal protective equipment (PPE) is the main cause for the rise. The World Health Organization (WHO) 2020 has recommended disposal practices for healthcare institutions, including regulated thermal treatment conditions or the use of conventional biocidal chemicals, which are efficient at getting rid of coronavirus. All COVID-19 patient-related clinical waste should be carefully collected in predetermined container and bag, processed and then discarded off properly or treated verbally on site. Everyone who handle medical waste should put on PPE and they should wash their hand afterward. The process of disposing clinical waste involves isolating it from produced garbage, which is then properly tagged and placed into container and bags. These containers and bags are subsequently picked up by licensed contractor for disposal and treatment at 12 separate incineration sites around the country, stated by Agamutu and Barasarati 2001. According to the specific recommendation, hospital trash is often collected and disposed of the ordinary home waste. Over the course of COVID-19 era, no new policy or regulation were passed. Last but not least, the waste generation must tell a carrier of the type of waste being carried and the step to be followed in the event of an accident.
Hi, I'm Rosh Amira binti Cik Din and I will explain in detail the effect of improper medical waste management. As stated by Idowu Ital in 2013, medical waste is produced through activities involving diagnosis, testing, treatment, research, or manufacturing of biological products for humans and animals. However, improper handling of medical waste can significantly affect the environment and public health. According to European Union statistics, the healthcare industry contributes at least 5% of the overall carbon dioxide emission, making it one of the most extensive contributors among non-industrial sectors. In addition, the improper management of medical waste is a prominent factor contributing to this emission, since the waste has the potential to release methane and other greenhouse gases into the atmosphere during the decomposition process. Next, we move to the case study of the improper management of medical waste. Based on the research done in 2013, which was carried out in 14 various healthcare establishments that developed many portions of the medical waste in Rajshahi City Corporation (RCC), the study revealed that the healthcare establishment under investigation produced 1495 kg per day of medical waste. It was found from the survey that there is no proper systematic management of medical waste. The improper handling of the medical waste in the healthcare facilities of RCC is causing the development of risky situations that make it easier for diseases like diarrhea, hepatitis, and other different skin problems to spread. This table provides information of the types of pathogens that can be found in the infections, medical waste, and the related disease may arise from exposure to them. In addition to health concerns,
Improper medical waste disposal also result in environmental consequences. Burning waste in the open air can release dangerous gases including dioxide into the atmosphere, especially when burning plastics. Next, a previous study by Panani and Jena 2021 revealed that the improper handling of medical waste during the COVID-19 pandemic has detrimental effects on both health and the environment. The phenomenon global pandemic has resulted in an unusually high amount of documented medical waste. An illustration of this is the reported rise in the medical waste in China due to COVID-19 pandemic, which is attributed to the increase of the personal protective equipment such as gloves, face masks, and eye protection, and their prompt disposal after the usage. This figure shows the maximum face mask used by the general population, which is in Asia region was found to be the highest in Eastern Asia, followed by Southern, Southeastern, Western, and Central Asia. Improper management of the waste produced by healthcare facilities and households has the potential to boost the transmission of COVID-19 through secondary norms. To sum up, improper medical waste management has far-reaching consequences on the environment and human health. Improper disposal practices such as unprovoked burning or incineration release poisons and toxic gases, donate to atmospheric pollution, pose respiratory and cancer risks. These effects emphasize the urgent requirement for proper management strategies, including effective waste segregation, safe disposal practice, and promoting the sustainability alternative to minimize medical waste, environmental and health impact.
Assalamualaikum, my name is Siti Ilimahira binti Mat Kamil. I will explain more about the strategies and recommendations to reduce medical waste. First and foremost, segregation and identification of medical waste. Medical waste should be classified into different categories based on its potential risk and characteristic. To make the management more efficient, each container must be color-coded according to their potential risk and characteristic. It includes infectious waste, chemical waste, radioactive waste, sharp waste, and pharmaceutical waste. For instance, red containers must be used for infectious waste, green for pharmaceutical waste, and blue for chemical waste. Besides, when waste is segregated at the source, it is easier to recycle. The waste must be also disposed in appropriate methods, such as incineration, autoclaving, or depends on the nature of the waste. In a study conducted by Alam 2015, they were observed that there was no segregation system for infectious and non-infectious waste healthcare establishment in Rajashahi City Corporation. Because of this, the medical waste in Rajashahi City, Bangladesh, rising and cannot be reduced significantly. Next, medical waste should be collected every day due to its hazardous nature. This is because some waste has potentially harmful microorganisms such as bacteria and virus that can infect hospital patients, healthcare professionals, and general public. Moreover, medical waste can emit unpleasant odor and attract pests such as insects and rodents. Thus, by collecting the waste daily, it can maintain cleanliness, hygiene, and odor control within the healthcare facility. In order to make sure that the medical waste is being collected every day without any unwanted obstacles, it is implemented to establish a scheduling system. The establishing a well-defined schedule for waste collection must be considered about waste generation rates, storage capacity, and regulatory requirements. Ensure that the schedule is communicated to all relevant staff members and waste management service providers. Always remind them to be punctual in collecting medical waste every day to avoid any hazards to the human health and the environment. In addition, reusable products can play a role to reduce medical waste. There are numerous medical devices, including surgical instruments, that can be created for multiple purposes. These devices can be sterilized and safely reused, reducing the need for disposal after a single use. Healthcare facilities also can drastically minimize their medical waste by using reusable devices rather than single-use alternative. For example, face shield can be made reusable. Other than that, reusable containers and packaging that used to place the medical waste or packaging for medical supplies and equipment can be adopted as reusable options instead of relying solely on disposable containers and packaging. However, due to safety and infection control concerns, not all medical supplies can be effectively made reusable, but those that can must be reused in order to cut down on medical waste. According to the study by Conradi in 2010, they stated that 4 million tons of general waste were produced by healthcare facilities in United States each year. Surprisingly, 70% of waste were from disposable surgical supplies, likely surgical drapes, gowns, gloves, and towels. However, when they produced and used reusable medical items, they were able to reduce an average of 65% of medical waste. Moreover, adoption of autoclave treatment also can reduce medical waste. Autoclave is a machine that uses steam under pressure to treat infectious waste such as harmful bacteria, virus, fungi, and spores on items that are placed inside pressure vessel. Autoclave is much better than incineration as it does not release the poisonous dioxin and mercury emission into the atmosphere. The amount of medical waste can also be greatly decreased with autoclave. The high temperature and steam generated in the autoclave will cause the waste to break down, shrink, and become compact. Thus, this volume reduction lessens the overall quantity of waste produced and helps landfills conserve space. Besides, autoclave have many benefits like sterilization, volume reduction, and cost effectiveness. It eliminates the need for external waste disposal services and reduces transportation costs. According to the study by Selvan Kristiraj in 2021, in India, autoclave treatment is effectively used to treat the medical waste in the categories of sharp medical waste, solid waste, clinical, and biotechnology waste. Other than that, ensuring that every employee is aware of the need to reduce medical waste as well as they have received training on waste minimization technique relevant to their job duties and responsibilities. With that, they will be more conscious of their role in protecting the environment in order to reduce medical waste generation and adopting sustainable practices. By having educated employees, they can efficiently streamline their workflows and improve efficiency in medical waste handling and management. Besides, by empowering employees with the wide knowledge and skills, they can develop innovative solutions and bringing good change to the country on managing and reducing medical waste. Afterward, government should strengthen the regulation on the administration of medical waste at the healthcare facilities in Malaysia. By tightening rules, healthcare facilities are required to treat and dispose medical waste in an environmentally friendly manner, minimizing the harm to ecosystems and the general population. Besides, strengthening regulations promotes consistency and standardization in the management of medical waste across all healthcare facilities. This guarantees that every facility, regardless of who owns it, follows the same set of rules and procedures. It ensures that the hazards associated with medical waste are equitably minimized. Last but not least, government should increase public awareness, especially to the person that involved in healthcare facilities. The government can implement a campaign in public facilities about the awareness of environment and human health if the medical waste is keep on rising day by day. This campaign should be at least twice a year. This can influence behavior change when providing information, guidance, and practical tips on medical waste reduction. Subsequently, increasing the public knowledge of medical waste. With that, people are more likely to take care of themselves and others from potential infections or injuries that brought on by medical waste when they are aware of the improper waste disposal. So, by implementing these suggestions and recommendations, healthcare facilities, governments, and the public can work together to reduce medical waste, protect the environment, ensure public health and safety, and achieve sustainable waste management practices.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Alia Irina binti Mustafa. Now I will explain the history of law and legislation in Malaysia. In 1918, AIDS was dominated and affected many people. After the first case of HIV in Malaysia, the medical waste management system was put in established in the clinical waste of department. Malaysian Ministry of Health and the Malaysian Department of Environment have amended a few regulations and protocol to manage infective disease and handle clinical waste. The example of regulation, which is the Private Healthcare Facility and Service Act 1998, the Private Healthcare Facility Service Regulation in 2006. This regulation will explain how to reduce the cost-effective recycling and recovering of the non-infective clinical waste to reduce the cost and minimize the waste generation. Next, I will explain the law and legislation in Malaysia. So, from the table, we can see that about 27% increase in the clinical we are reported by the Ministry of Health because of the COVID-19 outbreak. The reason of the increase of the clinical waste is because the use of the clinical waste such as face mask and glove. Next, let's look at the law and legislation in other countries. So for the first one is in Sudan. We can see that medical waste related is not specifically relevant there. There are no federal law regarding to medical waste management. However, according to the Khartoum State, a guidance is established for the management of medical, which is including labeling of type of hazardous waste and put it in the safety box. However, there are poor medical waste management happen in Ghana. The most of the medical facility in Ghana Greater Archery region refuse to follow the country medical waste management regulation. However, the Minister of the local government advised the rule to practice for managing medical waste and implement in order to safeguard the environment and the public health.
Assalamualaikum warahmatullahi wabarakatuh. My name is Hamka bin Suhaimi and I will present the challenges and limitation of medical waste treatment and disposal. There are two challenges that I want to highlight, which is the ineffective waste minimization and segregation and lack of awareness. Waste segregation is the process of separating the waste at source, which is crucial for the medical waste. Waste minimization for medical waste involves the strategy and practices that aim to reduce the production of medical waste and to ensure that there is a safe waste disposal for any waste that produced at the healthcare facilities. The medical waste segregation and minimization responsibilities lies on the hospital staff or any person that dealing with the waste itself. The guideline from the Ministry of Health stated that the waste should be deposited in color-coded bags or containers according to the degree of hazards and the characteristic of the medical waste. For example, the clinical waste should be placed in the yellow plastic bag, while the infectious waste should be placed in the blue plastic bag. Based on the previous study conducted at Hospital Sultanah Aminah Johor Bahru show that most of the clinical waste disposed in the black plastic bag rather than the color-coded plastic bag, as stated in the guidelines. The next challenge is the lack of awareness among the hospital staff or the person that dealing with the medical waste. The awareness among the person was due to the low responsibility of the public and the medical staff. The cost to manage the medical waste is higher than the normal waste because it required the specific facility to dispose the waste. Medical waste represents 10 to 25% of the total waste generated by the hospital, according to the previous study. The consequence when the medical waste mixed up with the general waste is increase the cost to manage the waste and dispose the waste safely. Now, I will talk about the limitation of medical waste management in Malaysia. Although there is various types to treat the medical waste, such as incinerations, autoclaving, microwaving, plasma pyrolysis, and landfilling, the specific requirement to treat the medical waste become the major obstacle. For example, the waste treatment that use plasma pyrolysis can cover a wide spectrum of clinical waste, but require high expertise and expensive operation costs. There is also a waste treatment that produce harmful byproducts to the environment, such as dioxin and effluents that comes from the incineration process. As a result, the limitation closely related to the waste minimization and segregation and awareness to manage the waste accordingly.
As a conclusion, healthcare activities produce a wide range of waste materials, including used needles, dressing, body parts, diagnosis sample, chemicals, medication, and radioactive materials. Inadequate handling of medical waste poses risk of infection, harm, and injury to patients, waste handlers, healthcare staff, and the general public, as well as environmental pollution. Proper segregation handling and disposal of medical waste are essential at the point of generation. Medical waste, also known as healthcare waste, HCW, contains potentially hazardous microorganisms that can infect individuals. Improper management of biomedical waste poses health risks to hospital workers and visitors. Organizations like the US EPA and OSHA stress the importance of following correct waste management procedures. Waste minimization should be prioritized, and protocols recommended by the Centers for Disease Control and Prevention (CDCP) or the World Health Organization (WHO) should be followed for handling innovative or unregulated waste. Public participation, awareness, and staff training are crucial for responsible and safe biomedical waste disposal. Understanding medical waste management and control procedures is vital due to its significant dangers and potential for serious illnesses.